It starts with small changes, a few new skin tags on your neck, or a patch of skin that has turned dark and velvety. Maybe your vision is suddenly blurry, or you find yourself getting out of bed several times a night to use the bathroom. Most people assume these are just isolated annoyances. We tell ourselves we're just getting older, or that we're simply having a stressful month. But these physical shifts are actually deeply connected. They are the outward manifestation of a single physiological development, prediabetes. This is a specific metabolic state where your blood sugar levels have risen above the healthy range, but haven't yet reached the threshold of type 2 diabetes. Your body is providing an early window into a systemic issue. Responding to it requires understanding exactly what is happening beneath the surface. The process is driven by insulin resistance. Insulin is the hormone responsible for signaling your cells to absorb sugar from the blood for energy. When your cells stop responding to that signal, glucose begins to accumulate in your bloodstream. Because the sugar isn't being absorbed, your body overproduces insulin to try and force the cells to react. This excess insulin triggers a growth factor that causes skin cells to multiply rapidly in certain areas. This is what creates those skin tags and the dark, thickened texture known as Acanthosis Nigricans. That explains the skin, but it doesn't seem to explain why your vision would suddenly change. When sugar concentrations in the blood reach a certain level, they begin to draw fluid out of the surrounding tissues. In the eye, this excess fluid enters the lens, causing it to swell and warp. This physical change in shape prevents the lens from focusing light correctly, resulting in blurred vision. These visible external symptoms are the side effects of a metabolic shift occurring throughout your entire vascular system. Clinically, this progression is often identified through 3 specific symptoms: polyuria, polydipsia, and polyphagia. Polyuria refers to the frequent need to urinate. This happens because your kidneys are working at their limit to filter out the excess sugar, which requires a significant amount of water to flush from the body. Because you are losing so much fluid, your body becomes chronically dehydrated. This leads to polydipsia, a level of thirst that a single glass of water cannot satisfy. Finally, there is polyphagia. Since the sugar in your blood can't get into your cells, your body believes it has no fuel. It triggers a persistent hunger, even after you have eaten a full meal, because your cells are effectively starving in a sea of glucose. While diet is a factor, there is another variable that can accelerate this cycle: a lack of sleep. Research indicates that just a few nights of poor sleep can significantly reduce your insulin sensitivity, making it much harder for your body to manage blood sugar levels. This creates a difficult cycle, where the body craves the very sugar it can no longer process, moving it closer to a diagnosis of type 2 diabetes. If you are experiencing these changes, is the progression toward diabetes inevitable? To find out, the Diabetes Prevention Program conducted a study of over 3,000 high-risk individuals. They wanted to see if medical intervention or behavioral change was more effective at stopping the disease. One group was given metformin, a standard medication used to manage blood sugar. This group saw their risk of developing diabetes drop by 31%. A second group was assigned to an intensive lifestyle intervention program instead of medication. The results were clear. While the medication was effective, the lifestyle group saw a 58% reduction in risk. Behavioral changes were nearly twice as effective as the leading pharmaceutical. The data shows that while drugs are important, the most effective way to address a metabolic condition is through the habits of the patient. The protocol used in the study consisted of 3 main parts. First, a weight loss goal of just 7% of initial body weight. Second was physical activity. The requirement was 150 minutes per week, which is roughly 20 minutes of brisk walking every day. Finally, the diet shifted toward high-protein and high-fiber foods while significantly reducing carbohydrates. This works because protein and fiber slow down the rate at which your stomach empties and your intestines absorb sugar. This prevents the sharp spikes in blood glucose that drive insulin resistance. The changes in your skin, your eyes, and your thirst are not a final diagnosis. They are an early indication that you have the opportunity to change your habits and stop the progression of the disease.